Stephen. So take it away.
Awesome. Thanks, Bob. We had a lot of great conversations yesterday, and some things that stuck out with me especially was Derek Dubosky had said, you need to tend to your garden and like start thinking about what you're going to start planting. And that's kind of the wheels and the mechanisms we want to kind of roll off on today, and taking full advantage of the tools that we have at our disposal for our healthcare delivery. And one of those things that we've been really trying to push, especially with the EMR, is the calendar usage. I mean, we can get a lot of good metrics out of calendar usage, and we're going to show you a lot of the new things that GHL has been working on. And to me, it's the meat and potatoes of what we've been trying to visualize in the past couple of years coming into fruition, and it's actually getting a lot more exciting. So I'll show you what I mean. The first little bit here, I'm going to get Steven to take over, and we're going to talk about this thing called the community beat report. So Steve?
Okay. Hi, I'm my name is Wobble Ganesh. They call me Steven. So we've been working on this community beat report where we have developed a template to start collecting data that we're hoping to give a snapshot in time of the various health centers. So this is sort of what we're doing is we're introducing, how we're doing it, the type of product that can come out of it, and that eventually we'd like to encourage some input from the communities as well too, as it is your report. So what we did is we've taken this template. Jesse, if you want to go to the next slide there, please. And this is just a draft template that we're using for now as the basis for how it's going to be developed, and that the client would fill this in as they came into the health centers. So you're collecting data as they come in. Some of it could be pre-populated in the sense that because there's existing data in the system, and it would again go into the system. And as Jesse was saying earlier, you have to input the data in order to collect it. And if you can just keep an eye on, the type of things that, as this develops, we're hoping to go and talk to the various stakeholders, and, we'll figure out a delivery model, whether it's going to program managers, to the health center in general, or public, and what have you, because that really starts to define the type of information that we are going to be displaying. And speaking of displaying, we can go on to the next slide there. Okay, there it goes. This gives you an idea of how we can take the information and throw it into different types of charts to give a visual display and snapshot, a very quick one. I'm sure we've all seen the various types of pie charts, graphs, line graphs, scatter plots, so on and so forth. For the sake of simplicity, we're just doing straight up numbers in this case, comparing one to another. And so as you can see here, we took concerns and conditions, and there's a long list of various things along the bottom, from arthritis to substance addiction and whatnot. And so, like, say, for instance, you look at this and you can see elevated numbers. And where this starts to come in handy is that you start looking at maybe how they change over time. And that this is something you might want to dive a little bit deeper into. And then this is where you could say, hey, GHL, can you give me a little more information on this? This looks kind of interesting that this is popping up on the radar. And, there's a number of reasons to collect this type of information. And one of them is basically to share amongst your colleagues internally. Another one would be to show, like, to work with other institutions to say, hey, this is what we're doing. Take a look at how our information looks. How does yours look? What do you do to get these lower numbers? That sort of thing. And as we go on here, here's what we're going to end up with. We want to do a self-assessment. So based upon the medicine wheel, mind, body, emotions, and spirit. And again, this is just a mock-up, okay? This isn't real data that we're using at this time. And but again, just to give you a good idea of where it can go. I really like that graph. And then the services sought. with the various programs, how many people are going in and out of the center. Once you start looking at something like this in terms of services as a program manager or as a manager, you might want to look at, okay, so what's the throughput? Like, how often are they coming in? Is it a weekly basis? Is it, is it over the months and what have you? So by giving you these community beat documents, or if it's online, we're hoping to pique your interest to dive a little bit deeper and get used to actually using the data itself. And in this case, it's quite simple at this point, but it starts to give you a general idea of how we can put the data into interesting shapes to help us better understand what's going on. And it really starts to help when you can have multiple data points to compare. I mean, just giving a number of 76, say, for instance, doesn't really mean anything unless you can compare it to other ones, and then it starts to give you a better idea. Okay, Jesse, if you can just go on to the next one. So another one, this is more of the, group programming area. So you have traditional programs. Some of them have physical activities and such that don't necessarily fall under, like primary care or health care, but they still fall under health care. But we can also collect this sort of data as well too. And there's actually quite a lot of activity within these programs. And this is a good example of, you could even look at interdepartmental sharing as well too, because a lot of these things cross over. And I know that there's some organizations now that are looking at integration, and indeed it has happened with like education and social services, that this would start to become interesting to them and perhaps even open the doors for more sharing. But again, these types of infos can also be directly linked back to a patient chart as well too, or it can be displayed on its own. But again, it gives you some success metrics of how things are working. And yeah, and that's us there. I went ice fishing, but I don't golf. Okay. Here's where we just showed an example of just a program. Again, this isn't any data. We're not displaying any organization's data because it's just not appropriate in this setting. But this is a perfect example of how we can have the data that is collected and to be sliced and diced into various shapes and sizes to give us the pertinent information. And it all depends if this is for the viewing of the program manager or if it's for presentation purposes or reporting. And I mean, that's a big thing, is reporting itself. But really at the end of the day, I believe that it should always be around improving services to the clients and patients, because that's really who we're all here working for at the end of the day. It's not to develop the better metrics, unless of course it can be equated to better healthcare and more efficient healthcare. And next. Now this isn't the other ones were more about patients and clients. Now this is just straight up, how is the EMR being used? Okay, so we have, you might have seen similar reports like this come across your desk. So this is just your own staff and how they use the EMR. So the first one, you have days since the last login. It gives you an idea of how often people are using it, or like this is, if you look at it on a regular basis, it's like, okay, I notice the same people are using it. They never have more than one day when they're not using it. And then you have people like greater than 30 days. In fact, if you look at these, there's some that are over 100. And if you ever get a report from us that has people that have not been using the machine, say for instance, over 100 days, 3 months, that you should take a closer look at the list and see if they're still working there and make them inactive, because it represents a security risk as well too, because if those accounts are still open, they could be being used by somebody else, or that person who is not working there may be able to access them and they're no longer part of the organization. The other one, activity by roles. I'm having a hard time reading it because it's on my little screen here, but essentially we have everybody broken up into roles, whether it be like nursing, mental wellness, personal support workers, program workers, and the list goes on. Essentially in each health center you have the same type of programming. Sometimes they might have it be named slightly differently, but everybody uses the EMR a little bit differently. And as a matter of fact, workers within the same role, well, they tend to use it the same, except for the manager of the program, because the manager of the program usually isn't involved in patient and EMR interaction. So, and the activity by roles, if you look down the side, it has a list of 4 or 5 things there. This represents actual like charting, like you're actually entering data about the client. So this is where, you know, the meat and potatoes of the system is, and it gives you an idea of what type of charting that they're doing. And, you know, the top 3 or 4 always tend to be patient viewings. You know, you look at the chart, demographics, and custom forms, and progress notes and treatment. Progress notes are fairly common. Logins by role, that is how often are people logging in every day. So it gives you a good idea of who's logged in that day, how many times, but also it'll give you an idea if you monitor it regularly. It's one of the ways that you can trace, was this person on the system that day? If, say, for instance, there was a breach, you can tie it into sort of your security audits as well too. And then the appointments no-show versus no-show rates, appointments versus no-show rates. So this is an interesting one. As Jesse was saying earlier, we can garner quite a bit of information. And once you start looking at this, you know, you look at the no-show rates, you might say, geez, this is really getting high. I wonder why that is. And you drill down, and then, you know, it could just be a particular person or something. And then you have to, you know, make decisions based upon that. Maybe they're no longer interested, or maybe you need to reach out to them, or so on. So this is like, again, we use this a lot to sort of determine where training may have to go and what type of things we may need to emphasize, but also you can really start to see where the power users are, and the groups that use it in certain ways. Okay.
Yeah, absolutely. And thanks for that, Steve. I mean, the value of these reports here is, you know, we're not taking full advantage of our information or what we could be getting out of our EMR. And most of these statistics and these figures that we've shown you here, this is just really from 1 or 2 custom forms that we have available. So, I mean, if we start thinking about what kind of information we want to get out, we're totally going to be able to tell a greater story about our community and deliver better healthcare in the future. And that segues in to what Nick is going to talk about here as I stop sharing my screen, because what Nick is doing here
I can take
is really the next step of what we're talking about here.
Move on, and it's just to go what Jesse was saying too. We can do a lot with this data, but the fact of the matter is that we're not healthcare workers, and we're not the experts in how your work is done and whatnot. So we really do need to have a collaborative approach towards this, where you can say, yes, this data is relevant. We require this data.
Yeah, so I'm just going to take off from there. So all those charts you saw in the community beat report PDF or PowerPoint, those are all things we can build right now if the data is supplied through the EMR. And essentially, whatever data or analytics you want to get out of your EMR, anything you want to analyze, we can provide that for you. And the PowerPoint was the first sort of stage of this project, the community beat report, where we were going to send you an annual report of the community beat with annual general statistics about your community that can help you provide better service. But we've kind of moved this project into a kind of next level stage where we've developed a community portal where we can start updating the portal with real-time analytics from your EMR. So I'm going to show you an example of it here. So the portal will just be simple, it'll just be community@goedenonghealth.ca, and we'll have a link directly to it from within your EMR. So you'll have a login within your email address. And when you log in, you're going to get a dashboard. And the dashboard is going to be all like the charts you like to refer to often, and charts that you think provide you the best real-time updates and analytics that will help you better serve your community. So for example, we can see the concerns and conditions from the community beat report. This will all be in the EMR and interactive. And as new patients in your EMR get updated with the extended demographics form and have their information updated, we can pull that from the EMR directly within the same day and have that information on here for direct analyzing. So as you can see here, it's the same as the community beat report, but now it's in a much prettier interactive format. And we'll have lots of charts on here, but I think the main key point is this will all be within real time within the week. You know, if you want to see logins for Q2, that'll be on here, but we could also do logins within your EMR within the past week, within the past month, you know, in the past 10 days. You can see who was the top login by role. You can see which user was the top login. So for example, here we have logins for Q2 by role, and you can just see that we could say nurses have the most logins, and then next personal support workers, and then next you could have the mental health counselors, and then the nurse practitioners. And then we also have like stuff related to appointments that could really help you on here. So for example, you could see the amount of appointments you made in the last month. And if, for example, you're a supervisor, you could have something like the top 3 calendar users that you supervise and the amount of appointments they made in the last month. So you can see if you're a manager or supervisor, you can see everyone beneath you and you can see how many appointments they made last month. And that way you can also keep track of who's using appointments and what type of appointments they're making. Now, the dashboard itself is fully customizable. You can rearrange and move the charts around. And you can also add them and remove the charts from your dashboard. So if you want to remove them, you can just click this button and you can remove it. And you can also print the charts for a little simple printing option. And this will just render the chart in a size that fits on an 8.5 times 11 inch sheet of paper. And if you want to get more charts, there's a little menu up here. And you can click on the analytics section. And then there's 3 categories of the analytics. The main categories are community, clinic, and then me. So within the community, that will be more related to the extended demographics form, where the categories will have to do with the self-reported data that all your patient and EMR clients will have self-reported. And then here you can see stuff like current substance use, services sought, and maybe the household composition of your community. But also, if you go into the clinic section, this is where you will get all the stuff related to your staff and the EMR. So in this section, it will be stuff like appointment frequency. So for here, you could see that by Monday, Tuesday, Wednesday, and Thursday, you would see that mental health counselors are making about an average size of appointments, and GHL admins. This is all fake data, by the way, but this is just showing the potential of what it could look like. So you could see, for example, that nurse practitioners have higher appointments on Tuesday. And then other charts could be like the counts of appointment types. So you can see within the past month or so, or the past quarter, how many different appointment types you had. So you could have stuff like smoking cessation appointments, back to school appointments, mammogram appointments, and you can all see how they relate and how your clinic is actually performing these appointments and how frequently they come up. And all of this relates to calendar usage at the end of the day. If you're not putting in these appointments on your calendar, we can't pull these statistics and then provide them back to you for your own analysis and better serving of your communities. Other charts that in here would be the login charts. So login transactions for quarters, quarterly logins or weekly logins. And then another cool one, this one's kind of big, but it's actually really cool once you look down to it. This is the Q2 activity by date. So you can see by each date from July to September, what different types of activity were done within your EMR. And this is also good for auditing, and you can see, you know, if there's anything weird happening within your EMR, if there's any weird transactions and stuff, this portal will help provide those services for you in a simpler manner than PS Suite provides. And then the last section is the Me section. And this section is just, it's going to be for personal stuff. So personal statistics, for example, the amount of appointments you made, maybe the staff you supervise. Also, you can see your own login transactions and see how you're performing. And that can relate back to trying to incentivize EMR usage within your community and within your clinic, because you can have the users look at their own statistics and be like, well, if you can, you know, start putting in your appointments and the amount of appointments you make offline, if you bring this up, you can provide incentives to do those sort of things. And you can use these tools to help you come up with those incentives. And for example, you can see the amount of appointments you made each month too. And it's kind of like your own personal statistic page, but I feel like a lot of you who work at the clinics might actually want to know that. You want to know how many appointments you made each month that were foot care appointments or flu shot appointments. So then we can go into the support page. This is just a tiny little support section of the portal. And this is just, this will contain frequently asked questions about the EMR, like how do I change my password? My role follows CBRT reporting requirements. How can I ensure I'm able to find my data when it's time to report? All these questions will be answered in a simple format in here. But if you have more questions, you can always go to the support request section. And here we have a little ticket portal where you can submit tickets, and you will get it attached as an email to your own email address, as well as it will directly go to the support team at GHL. And we will be prioritizing all tickets from you and from within the system to get answer your needs as quickly as possible. And then the last page on the portal is the account page. And here you can just provide your phone number and address if you want to. That could just help us better service you. So if you want to provide your phone number, so then we can directly contact you about supporting needs and EMR needs, you can provide that to us. Yeah, so that's the portal, and all the charts in here you can, within the categories, you can add to your homepage, and you can customize your homepage in order to have the charts you want to see most frequently whenever you log in. Yeah, do you have anything else to say, Jesse?
Well, this is such a valuable tool, right? I mean, this is something that we've been working towards the entire operation of GHL. This is going to allow providers to see real-time data at their disposal, and the power of that is incredible. And something to keep in mind for everybody watching right now. You know, this takes a little bit of buy-in to get going at first. So we can't necessarily promise you that we can get this going right now. There needs to be a system of input data. You can't get out what you don't put in. So I want you guys to start thinking of stuff like that. And again, a lot of these charts and figures, some of them you can do it automatically already in the background based on EMR behavior. But again, a lot of it is how you put the data in. So I want you guys to start thinking about that and buying into these systems. And we can talk about that after the conference. But this is a great information session. And I thank you for that there, Nick. I'll take over the screen from you there.
Yeah.
Sure. And then we're going to transition into our last little piece here with regards to providing better health, especially in the time of a pandemic, COVID-19, is these virtual visits. And virtual visits are essentially a new way of delivering our services that aren't necessarily face-to-face. Now, we had some polls yesterday with regards to, you know, what kind of delivery of healthcare services are going on in our community. And I believe, Evan, you might have a poll available for us right now, if I'm not mistaken. Yeah, let's take a quick second, if everybody can, to do a poll. And it's based on this quick overview of the dashboard functionality. Which of these following types of dashboards and reports do you see the most valuable? So before I go into virtual visits, I just want to get a little bit of feedback with regards to what you guys have really taken the most out of with regards to what we can do with our dashboards.
Perfect. Yep, we got lots of people answering. We're just going to give it another 30 seconds or so.
Mm-hmm.
This is really exciting stuff. You know, it's very cutting edge, and I get excited just all this dashboard, community portal. You know, it's very cutting edge, and I think really exciting stuff. So I get excited just watching these guys present it.
Mm-hmm. It's also exciting because I had a question the other day on the PS Suite EMR if they could add COVID-19 immunization data to their home toolbar on PS Suite, and I didn't think that they could do that, but I was just thinking that in this portal you can actually, any custom form that we can grab data from, we could do that and then import it into here, and then that would be an easy way to access any statistic from any custom form that you want. We would have to craft it for you, and then we could have it start automatically magically updating every time new data gets inputted.
Exactly. Sky's the limit on this stuff, and
Mhm.
we can really use it to streamline our workflows accordingly. So I think that's enough for the polls. It looks like we've got a really strong demand for community diagnosis and rates and community health and community demographics and snapshots. Keep in mind too, with the CBRT reporting stuff too, we can start to customize that information in real time as well.
Mhm. Also, if there's any questions, you can send them in the chat now or unmute yourself and ask as well.
Yep. So I'm going to segue into virtual visits. I won't take too long
Oh
with
yeah,
this.
that's right.
But the idea is with virtual visits is we want to deliver healthcare in a different format, in a different platform, and that's using Telus Health's new add-on feature that is available in PS Suites right now. Now, not everybody necessarily has access to it right now, and it involves a little bit of a sign-up program where we need to have information on who's going to be using it in your clinic before we can set it up. So the idea is it's very simple. Once we start using the calendars a little bit more, the idea is you go into your appointments and you would develop your appointments and schedule them as you would regularly. The only difference is with a virtual visit is there's a button down here on your demographic or sorry your booking window that says virtual visit. And when you click that virtual visit button, it's going to generate a link once you've booked that appointment. And so as a provider, I have a link on my end associated that connects with my patient. So as long as the patient's email is collected in the demographics window, that email will be sent to that patient saying you have a virtual visit on Friday, October 30th at 11 o'clock or whatever the scheduled appointment is. And so when that appointment comes closer, they're going to get again an email. I'm going to have an email, and when I go look in my calendar again, there's going to give me an option to start virtual visit. And so when the time of the appointment comes, I'm able to start the virtual visit. And this is what appears on the patient end, is that they'll get an email that says your upcoming virtual appointment is coming up, and you have the option to test your connection beforehand if you may be experiencing difficulties with your setup, and then you can go straight into your virtual visit. Now, this is what the waiting room looks like on the end of the patient. So they click the link and they're sitting in the waiting room and they're all sad in the corner, you know, waiting to be seeing the doctor. Oh, I don't know how this is going to work.
Happening.
Let me just mute.
Yeah. And so this is the prompt waiting room that they'll be in until the provider has accepted or opened up the web room for the virtual visit. And this is what it looks like. So happy customer or happy patient in the corner, and Dr. Bird here is sitting in his office on another side of the world, who knows where. And me as a patient, I'm able to get services right from my couch without any risk of exposure. So I mean, this is something that has tremendous value right now, especially to high susceptibility populations to disease outbreak, such as First Nations communities. This is something that we should all really be thinking about if we haven't installed it or have begun the process of initiating it into our clinics yet. And so I'm going to leave you guys with that and with a little bit of a birdie in your ear to remind you again, if this is something you're interested, get in touch with GHL, whether it's any of the staff you've seen in this presentation so far or Evan. And it's very simple to set up. It'll only take a few days to get the list of names through Telus and sign everybody up so that we can start getting this going. And if you need any resources with regards to training and how to use this virtual visits piece, we've got actually a resource bank full of different tutorial videos on our website, www.giwinunghealth.ca/resources. And there's actually quite a few tutorial videos, not only for virtual visits and calendar usage, but a whole array of different material and things that are going to be of value for you guys. So I encourage you to take full advantage of that. And with that being said, I think we can open up for a little bit of a Q&A period.
Right on,
Jesse,
Jesse. And I see the website on there, giwinunghealth.ca/resources. And I like how you referred to it as a bank. I like banks. Saves me from having to stash my money in my mattress.
Exactly.
I've got a couple questions already. The first one is from Stephanie, who asks, how secure is the virtual visit option?
The virtual visit option is it's totally built by Telus, right? So it's got the It abides by the FIPA guidelines, the Private Health Information Privacy Policy Act. So in terms of like a comparable platform, it's one of the most secure encryption platforms for delivering that service that there is available on the market right now.
Very nice. I've got a question here. How important is it to have all the various communities using standardized forms in order to create the aggregate data? And has that been a challenge so far?
That is totally a great question, and I'm glad that that's kind of being asked right now, because that is single-handedly one of the most valuable things that a health center can do, is identify those standard forms that they use on a regular basis, and really break down what they need to get out of those forms. And that has been a little bit of a challenge with regards to getting the correct data out. We had talked about a little bit earlier. You can't get out what you don't put in. So having standard
Right.
forms across the board is pivotal for that success.
Huge key message there, Jesse. For all the users that are online, if you're part of this conference, you have to be able to provide the data in order to use the data. So, it's part of organizational change and part of the culture that we need to change, that we need that data to make good informed decisions to improve how we serve our clients. So, we need to be thinking data every day. I know we have to do the service and actually make sure our clients get to their appointments and offer them that those services that we do. But once that's done, or as a part of that, we need to upload the data. We need to make sure that that's full. I've got a question from Alicia Boston. Will it be possible to customize the dashboard by separating mental health data from medical health data? Interesting question.
Yeah,
I'll let Nick take that one.
Yeah, I can take that one. So with the dashboard, right now we only have community, clinic, and personal categories set up. But again, this is in a prototyping stage, and as we are building this application all in-house, we are looking for your input on certain customizability and certain categories and other features we could add that would help best service you. So for example, if you're interested in having mental health data separate from medical health data, we could add another category in order to separate that for you. And if any other like sort of categorization issues pop up where you want things in a certain area of the dashboard, or you want a certain category to click on that you can see more specific related data, we can do that for you. We just we need your input, and any more questions like that would be great, because that'll help me with designing the categorization and the prototype application itself.
Wonderful.
Yeah, for sure. This is a team initiative. This is something that we all need to work together on to be able to achieve successfully.
So any more suggestions like Alicia's are awesome, because I will
nice.
we'll try to work on and putting those in.
And that starts with, again, going back to this custom forms. What standard forms do you use to capture that data?
Mm-hmm.
And I've got an interesting question, a follow-up from Alicia. If we were to book a training session, could we book a consultation to customize the form, or even customize the dashboard and something a one-on-one?
You bet.
Yeah.
You bet.
Yeah, that's one of the great things about Zoom is, it's very accessible. A lot of people are kind of shying away from it, but it's the future. It's immediate. So, if we could get on here and Jesse wants somebody wants an appointment with Jesse at 10:30, we could set it up. We can make those things happen. So, how about a big virtual round of applause to Nick, Stephen, and Jesse for all of their great work.
Awesome.
Thanks so much. Thank you.
And one thing I just wanted to add, I was just sharing my screen a minute ago, but I just wanted to reiterate what Jesse said. Our website, humanhealth.ca, with resources, we have a large resource of training videos, and I encourage everyone to check them out. We spend a lot of time, and they're really good tools to refresh your training, or just if you want to learn something new. So definitely encourage everyone to check that out.
Thanks very much, Evan. Really appreciate that. All right. Thank you very much, Nick, Stephen, and Jesse. You can have the rest of the morning off. No, just kidding. We've got a great presentation coming up next from Dr. Karen Gordon. It's going to talk to us about the power of resilience, stress management, and refueling. And I think we heard that a couple times yesterday about the importance of looking after ourselves. We can't serve our clients and our communities unless we're taking care of ourselves first. So the talk